Hi, I'm Viv and I'm the face behind Skinpharma Aesthetics in Stockton-on-Tees. Hope you're all doing well this evening. Tonight I'm continuing our journey, the journey of myself and Dr. Sunny Dhesi, talking about our journey in the use of ultrasound in our aesthetics work. Hi Sunny and hi Jose. This evening we're very lucky and proud to be joined by a specialist from the Canary Islands in Gran Canaria, Dr. José Ferrandis, who specialises in skin problems and also trichology, which is the study of hair growth. And he'll hopefully be joining us shortly. I will just add Sunny. It won't be a second. There we go. A second now. Doing about, this is our 12th Instagram Live with another practitioner. Hi, Sunny.
Hi, Viv. How are you?
Fine, doing well, thanks. Have you had a good day today?
It's been a long day. It's been a long day. I won't lie. It's different combinations of treatments, and I mean, all good from the clinic, but just a long day. How about you?
Yes, yeah. Again, lots of different things I've been doing. I've been looking back at our Instagram lives, since we started in April, and it was strange to look back and see how we've changed and progressed over that time. We've got quite a few people. There's Mariam. Hi, Mariam. Hope you're doing well. Hope you're doing well. I'll send an invite to Jose. I'll be 1 second.
Is he joining us from? So is he in the Canary Islands now, or is that where he's based?
I think he's based in Gran Canaria, and
okay,
I think he's joining us any second now. Hopefully, he'll be. Here he is.
Okay. Hi. Good evening, Jose.
Hello.
Hi. Good evening. How are you?
No, good evening.
Good evening. Good evening. So, go on, Viv. You take the lead.
Yeah, thanks for joining us, Jose. Really kind of you. You're based over in Gran Canaria in the Canary Islands, and
Yes.
You've been having a bit of rough weather recently, I think. Is that right?
We have been in trouble last week because of a tropical storm, but that's not usual. The weather here is almost perfect. We have one of the best weathers in all over the world.
I've been to Tenerife a few times. I've never been to Gran Canaria, but really nice weather all year round. So thanks very much for joining us this evening. I'll let Sunny speak to you a little bit, introducing you. So I'll let him take over, and then I'll speak to you a little bit about some examples of your work, Jose, if that's all right with you.
Well, I'm a medical doctor since 1994, which is near prehistory, and I am a general practitioner, and I have been emergency doctor as well, but I always liked the aesthetic side of medicine. And finally, in 2012, I started my aesthetic studies, master in aesthetics, and finished in 2013. And I've been performing aesthetics from then on.
Correct. I'll let Sunny carry on.
Yeah, Jose, that's like you said, a long history of doing medicine and a combination of emergency medicine as well. What was it that brought you? What was it that attracted you to aesthetics? What was it about aesthetics that you said, well, I'm going to change my sort of direction in terms of my medical career?
Well, there's a concept that is called wellness, and it includes not only health, but also many other aspects that make you happier.
Yes.
I cannot describe better than this. It's the search for happiness, and nowadays the physical aspect, the physical look, is very important for all of us. We're communicating through the internet by our image, or our personal image, and it's very much important maybe that it should, but it is. So I like to help people also, not only in recovering health,
Yes.
but also improve their looking.
Do you think that you naturally progressed to that point because of your background in general practice? Do you think that played a part in the kind of patients you were seeing, maybe in general practice, and then what you could do privately? Is that what influenced you?
I think it's a natural progress. I feel a general practitioner, but I can be a general practitioner even performing aesthetics. We're not treating just the skin or looking of a patient, but we're treating and diagnosing the patient, the whole patient. And
I know
that's the spirit as well of the general practitioners.
Yes, yes. No, as a GP myself, it's exactly the same sort of progression. And obviously, Viv, you've worked in primary care as well.
Mm-hmm.
When did your real interest in dermatology and trichology, for those that who don't know what trichology is, obviously hair rejuvenation and study of hair, when did that interest start then?
Mm-hmm. Well, I started to collaborate with a multidisciplinary dermatology team here in Gran Canaria 5 years ago, and they perform dermatology, clinical dermatology, but also aesthetic dermatology. And I share with them since the beginning my knowledge in skin ultrasound, in facial aesthetics, and many other things. And by a natural progress, I was including the trichology that I interested since the beginning, and in the last 2 years, even hair surgery. I don't know why. Maybe by solidarity.
maybe. I can't. I mean, sorry. Yeah,
it's too far. It's too far gone for me. I've gone way past that point, Jose. So no point talking to me about it.
Yeah.
And I mean, the focus of this introduction to you, Jose, and your practice is about ultrasound. We've had our journey. How did because you mentioned about dermatology, was that the natural progression then to interest in ultrasound, or was it something else that sparked your interest in ultrasound?
Well, there's a position statement amongst the world experts in skin ultrasound in dermatology that describes that skin ultrasound must be performed by a physician.
Okay.
But not necessarily dermatologist, and it's this way because you must only know the skin, the injuries, and describe them. If you're working with dermatologists, you have no problem to do this. It's absolutely great. You can extend your practice in skin ultrasound and be a part of a team. I don't think it's a problem. It's a huge advantage.
No, good. And how many people are using ultrasound in aesthetics in Gran Canaria at the moment?
Not so much. I'm one of the few of the only. But I'm trying to train, to teach, and to extend the use of skin ultrasound, because I think it's necessary. I don't understand aesthetics without ultrasound by now.
No, we agree completely.
In the past, we have practiced aesthetics by arts, by skills, by experience. But that's not the scientific way to practice medicine. and I'm trying not to be one of the only, or the of a few of them, but I'm trying to be the first, but not the last.
Not the last, no, definitely. And you mentioned, are you training other people now in your practice? Do you invite people along? Have you got a training course in ultrasound?
I have started training 1 year ago. I have written some courses, some online courses and webinars during the pandemic. And by now I'm beginning to collaborate with local and national Clarius dealer, which I think, I'm not working for Clarius, but I think
neither are we.
It's a great device to democratize the access to skin ultrasound, because you have not yet. That's like mine.
Yes.
You don't have to spend a lot of money to get high quality skin ultrasound images, and that's great. That's the only way to make it for everybody in aesthetics.
Go on, Viv, over to you. Some images, I think.
It's really nice to be able to speak to somebody like you, Jose, somebody who's in another part of the world. Your practice is different to how it's carried out in other areas, and things are progressing for you, just as they have been in the UK and other countries as well. You mentioned about the Association of Canarian Aesthetic Medicine. How do you, what position do you have in that association? What do you do for them?
No, really, I'm a member. I'm not I'm just a member in Canarian Society, in the Spanish Society of Aesthetics, Spanish Society of Ultrasound. But being just a member is not a reason to do nothing. You must collaborate as you can if you want to improve your practice, and I think that association is a great way to do this.
Yeah. Do you also speak to other practitioners around the world because of the internet, social media? Do you speak to lots of other practitioners around the world, like myself and Sunny?
I don't understand the question.
You've met myself and Sunny now because of Instagram. Have you been in contact with others as well because of Instagram?
With others?
Other practitioners?
Yes, I try. In fact, I commented in one of your lives, because of this. I don't want to be isolated. I live in an island, but it's a wonderful island. But I don't want to live in an island in my practice. So I try to connect with Spanish. Spanish spoken is much easier for me, but all over the world, I know many of them, but just by seeing. But I think it's step by step, and some of them are beginning to know me. I don't want to be known. I just want to insist, collaborate, and extend the use of skin ultrasound. I love it, and we must work together for this.
Yeah, there's one of the practitioners we've spoken to in the past, Carolina Mariluis, who's based in Argentina. Spanish. Her English is far better than our Spanish, myself and Sunny's. So I think you're doing really well talking to us anyway, Jose. So thanks for that.
Thank you.
Anything else you wanted to ask, Sunny?
No, I was going to say, why don't you go over some of Jose's images that he's shared, and then maybe Jose can, whilst you're holding them up, maybe Jose can talk us through some of it, or give you go with the lead, Viv, and just say what you're showing up.
Yeah, so I thought it'd be interesting, Jose, just to show some of the work that that you've done and some of the work that you do ongoing using ultrasound. These are different images and videos that you've carried out, and you've been sharing them with me over the last few days. It's really amazing work that you do. The first one of these is actually a transverse non-surgical rhinoplasty scan, and it involves dermal filler in the nasal in the tissue in the nose. Just describe it for us, would you, Jose?
Well, this could have been a huge disaster for the patient. She was injected by a non-authorized person, which is a huge problem all over the world. We can see the epidermis and dermis quite well, but those dark hypoechoic, anechoic vacuoles is the word. Vacuoles.
Vacuoles, yeah.
Are lying on the subcutaneous layer.
Yeah.
And surrounding, even surrounding the right dorsal nasal artery, what could have been a disaster in terms of ischemia, necrosis. Luckily, it didn't have place, it didn't take place, but yeah, the patient only felt itching and redness. But it's a good example to see what can happen if we inject just by our intuition.
So Jose,
much more if the injector is not prepared for this.
Sorry, Jose. So with that patient, it wasn't necessarily that she had any necrosis or anything, no presentation, no concerning presentation. It was just that she had some redness and itching. Is that right?
Well, she had very few symptoms, very soft symptoms,
yes.
And I decided to
ultrasound,
continue and see, and I performed a new skin ultrasound in a couple of days, and maintain contact with her, and she was improving. So I preferred not to inject hyaluronidase or so, because the main thing is the wellness of the patient, and well, it could have been worse, but it wasn't.
That's good. That's good.
So yeah, it's just really, the ultrasound doesn't mean it shows you when you do have to treat. It also helps you to recognize when you don't need to do anything. It's a benefit in both ways. I suspect that's what this shows, Jose. You must see lots of different problems like that all the time.
Normally, I just scan to my patients or our team patients, but sometimes some patients from other clinics or from other professionals, and even from people not prepared for aesthetics, arrive to us and trying to get a solution or get a diagnosis, and they're very nervous, they're very anxious. And just the information that we can provide with skin ultrasound is helping.
Yeah. Thanks for that. Another example. This is a lip scan showing the superior labial artery. You can talk about these couple of patients, Jose.
Mm-hmm. Well, these are two patients in this video. This is the second. The idea of this video is to express the variability of the anatomy, and especially in terms of vessels. Here we can see in the first part the superior labial artery laying in the submucosa, which is very frequent, and and it goes superficial in certain place to the subcutaneous layer through the orbicularis oris. And the second part of the video, we can see just the opposite. The arteries in the subcutaneous and through the muscular to the submucosa. And we must know where are those arteries before, not after injecting, so we can get better results, but of course, safety of the patient.
Yeah, definitely. Those videos are really good, aren't they? Showing that probably 90%, 9 times out of 10, you'll be fine, but it's that one time that you wouldn't even suspect it. But you could cause compression, you could potentially just inject. And if you're not, I mean, you know, even just in a compression element would then, you'd think you're causing a vascular occlusion, and then, you know, how do you treat that? But ultrasound just goes to show that, let's just say it did happen, and even with ultrasound there, you can then look at that Doppler flow and see what's actually happening with the blood flow. It's
not easy to inject inside the artery, but it's very easy to compress the artery.
Exactly, and those 2 videos, Jose, are really good examples. So thank you so much for sharing those. Viv, I think you had some more as well.
Yeah, there was a couple of other ones. This particular one is to do with alopecia, androgenetic scalp alopecia. It's an image. Now, it's amazing how you can pick up hair follicles in the skin. You can talk a little bit about this scan, Jose.
Okay. First of all, the red arrows fit placed by me. No, I wish that Clarius could do this for us, because this is not an easy scan. But what we can see here is the hair follicles, the shape of the hair follicles, like an hypoechoic lines, parallel lines through the dermis. And if we can see those fine lines, we can be sure that there's no inflammation. And this is important because normally we think that alopecia is a non-inflammatory process, but that's not true. And trichology includes a huge variety of alopecias, and even inflammatory and scarring alopecias. And it's important to assess a good diagnosis and good treatment to know if there is any kind of inflammation, perifollicular inflammation.
It's amazing how you can pick up that detail using the likes of, that was with a Clarius ultrasound scanner, wasn't it, Jose?
With Clarius L20, with the same than yours.
Yeah. Do you use any other scanners for other work? Do you use other types of scanners as well, did you mention?
I use an Esaote, which is a fabulous scanner, but it's a traditional scanner. It's a big device with wonderful probe in 22 megahertz. But I'm using Clarius mostly because of its advantages. I attend more than one place in the team, and even in 2 islands, so I can take the Clarius with me and with my hand luggage, and I have a very good sonographer wherever I go. But most of the image that you're seeing are taken by an SAOT. Okay. The alopecia that we have seen right now is a Clarius image, for example.
Okay. There was one other one involving the hair follicle. This was an inflammatory alopecia scan.
Yeah, and that's the difference. We can see in the Doppler mode that there's intradermal signal, and the shape of the follicles is not that fine line, but it's blurred and it's hypoechoic, but all the dermis is blurred by because of edema. And edema and increase of vascularization are signs of inflammation. So we can know that we have an inflammatory alopecia, and combined with the clinics, with clinic information, we can assess a better diagnosis.
Wow, that's pretty amazing.
And many times, even avoiding biopsy, because at least for following the patient, because the degree of how do you say, certainly we can know with security that this is the diagnosis.
Yeah, definitely.
Incredible.
I get a little stuck, sorry.
No, it's okay. No, you're good.
No,
You're good.
it's amazing the different work you do. I'm quite amazed at the different types of work that you're able to do using ultrasound, Jose. Really kind of you to go through all this with us. There was just a couple of other skin scans, skin tumor scans in particular. The first one is it's what you described as a Polaroid Hydrodinoma. Talk to us about this, Jose.
Well, this scan is a typical image from benign tumor, where we can see the borders well defined, and there's no Doppler signal inside, and the tumor is compressing the structures, not infiltrating the structures, and those are typical characteristics of benign tumor. And again, combined with the clinical image, we can be sure that this is not a malignant tumor, and we can measure the tumor, plan the surgery removal, and so.
That's amazing. That's a really good use, isn't it?
Incredible. One last one, Jose. This one was basal cell carcinoma. So I've got two images there. One's with the Doppler, one's without. You can describe those, Jose, if you like.
Okay, and that's the other side. Here we are, an image, hypoechoic image between epidermis and dermis, and the borders are not so defined. It's infiltrating the union between epidermis and dermis, and if we activate the Doppler, we can see that there's a
high degree of
signal.
Yeah.
And again, combined with a dermoscope or so, we can be sure that this is a basal cell carcinoma. And we can again assess the surgery with echographic ultrasound Breslow to know the deep of the tumor, and to be sure that we remove the whole tumor.
Amazing.
Yeah.
I'm quite amazed because I've never come across this before, other than with Mariam, who we spoke to a few weeks back. She looked at skin tumors and use of ultrasound to detect and treat. And I think it's quite amazing the work you do that I think most people just wouldn't realise can be accomplished using ultrasound. Any comments, Sunny?
No, I mean it was a really good demonstration, Jose, of a benign tumor and obviously a basal cell carcinoma, and you could see how the well circumscribed area of that benign tumor and then the infiltration, and as Mariam showed us before, that vascularity. Now, obviously, in general practice, you don't always have a dermatoscope, and we have a teledermatoscope. So, you know, basal cell looks characteristic, doesn't it, generally under a dermatoscope? But the fact that you can provide potentially for minor surgery all that extra information is, you know, can speed up diagnosis, and that's the main thing, isn't it, for the patient? You're speeding up that diagnosis. So really, really good examples. So
that's
Jose,
one of the reasons, because of skin ultrasound should be in hands of general practitioners, not only dermatologists, not only aesthetics, of course, but also any medical doctor that cares of skin of his patients.
Well, you see, if it just gets added on to the medical school curriculum, then we're on to a winner. So Jose, we always ask this question of practitioners, clinicians like yourself, who are, you know, heavily invested in promoting or using ultrasound for patient safety. Where do you think ultrasound is going in your practice and in general around the world? Where do you think, where is the trend? What do you think the future will look like for ultrasound in aesthetics?
Well, a couple of years ago, I wasn't optimistic, but there's something happening. We are here right now, you and me, talking about skin ultrasound. 2 years ago, this was I wouldn't believe it. There's in the last conference of the Canarian Aesthetics Society that you asked before, the most expected speech was mine, but not because it was me, but because it was about skin ultrasound. Something is changing, something is moving, and I'm optimistic now. I think that in very few years, every aesthetic practitioner will perform skin ultrasound in his or her daily practice, and I'm trying to help this, training people, training colleagues, and so I feel optimistic right now.
Brilliant. Viv, I'll let you have the last word, and thank Jose as well.
Thanks very much, Jose. I think anyone who isn't following you, I think should. I haven't reversed this image, unfortunately, but it's José Ferrandis. Just follow Jose, and he's on Instagram. Really nice person to speak to. Lots of information, knowledge, and ability that you have. So we both want to really thank you for joining us this evening.
Thank you so much for inviting me.
Oh, it's our pleasure, totally our pleasure, Jose, really kind of you. I think I was just going to mention next week we've got a practitioner. We're starting a set of lives in October, and we're looking firstly at a practitioner who hasn't started using ultrasound yet, but she's followed us from when we started our series online, and she's called Lynette Mays at Kalo Aesthetics in Belfast. And she'll hopefully be joining us next Thursday, the October the 6th at 8:30, and we'll be speaking to her about what she thinks of ultrasound and how she thinks she may start using it in future. So we're doing a chat with a practitioner who is at the early stages, perhaps at the very beginning, before starting use of ultrasound. So it'll be nice to speak to her. But that's really it. I think we've really enjoyed speaking to you, Jose. I hope you've enjoyed it as much as we have. And we will perhaps in the future meet up perhaps or speak to you again online at some point. But we just want to say
now we have someone who lives in Gran Canaria, so we're going to come visit. What are you talking about?
We will come and we'll spend some time in Gran Canaria on a nice weekend or a nice week there at least, and we'll see you some point in the future, Jose.
There's so many planes coming here. You have no problems with flights.
Oh,
When
definitely.
you want.
We'll be there with our
When
bags,
you want.
Jose. We'll be there with our bags. We'll be coming to stay. So.
We've got so many places to visit now because of all the people that we speak to. But really kind of you, Jose. I hope you have a great time with your work and with progress of ultrasound in your clinical work. And we may well organise a future live with you. I don't know if there was any questions that popped up. So was there anything?
There was one very last question. It was actually from at the end. It's from Annie Maltz. Annie's asking, where did you learn and practice about skin ultrasound? They are a radiologist from Nicaragua. So I think, Annie, with everything, and you guys can comment as well, there is no standardization. I think it's literally getting the ultrasound, looking at skin, looking at the textbooks, and then there are online courses. Obviously, Jose, you're doing a course, you've got courses in Gran Canaria, and there are other practitioners that do it as well. So Annie, I think follow Jose, follow us, follow any of the practitioners that we're following, and a lot of them have courses. Obviously, we'll always mention Leone and the Dutch team, and they have their cutaneous, they have online courses as well. But for skin specifically, as Jose just said, he's a pioneer in it. I don't think the training exists, does it, really?
It's beginning to exist.
Yeah.
It's beginning to exist. I insist in 2 years, in 1 year maybe, we will be talking about many courses, practical courses. This is important. Theory courses are not useful.
No.
In skin ultrasound, you can know everything about the skin ultrasound, but if you do not scan, it's nothing.
I think Jose, I think you need to set up an international course for obviously Spanish speakers as well to come and do a practical skin ultrasound course in Gran Canaria. I can just see the hotel filling up now for you.
We'll be at the front of the queue, Jose. We'll be there.
Yeah.
Okay.
Okay, guys.
Thank you very much, and we will catch up with you at some point in the future, Jose. Thanks a lot for joining us.
Thank you.
Bye, Jose. Thank you.
Thanks.
Thank you.
Bye.
Bye-bye.